Hi, everyone. This is Kristen Egger. Today's healthcare topic in the IDChat Podcast series is multi-factor authentication. What is it and how can it help address common problems such as medical identity theft or incorrect patient record retrieval? Joining me today to educate us on the topic is Catherine Schulten, and she is the VP of Product Management at LifeMed ID. Catherine, I've heard the word authentication thrown around quite a bit recently. Can you tell me what this is?
Absolutely. So authentication is the process or action of proving or showing something to be true, genuine, or valid. Another way of thinking about authentication is using an identity token, something you have, something you know, or something you are, to prove that you are who you say you are.
By what means is that carried out?
Authenticators are factors that one is assigned that they can use to assert their identity. So let me give you a few examples. First of all, there's the something you know. Something you know is something like a login, a passcode, a PIN number. These are all pieces of data that supposedly only you should know. Something you have is something physical. So that could be like a credit card, a smart card, your smartphone. These are all examples of hard tokens or something you have. And the final type of authenticator or token is something you are. And we know these to be things like biometrics. So your facial image or your fingerprint image, those are examples of biometrics or something you are. When used in combination, the ability to spoof the identity is made much more challenging. We often hear the phrase multi-factor authentication or two-factor authentication, meaning you should use two or more of those identity tokens that I just mentioned. The best way to use them in combination is to use two of two different types, meaning use maybe something you have and something you know. A great example of that is your ATM debit card. You have an ATM card, that's something you have, and you apply it with a PIN, that's something you know. That's a great combination of two-factor. But notice that there's also a weakness in that design. You could give your card to someone else and tell them your PIN number, and they could take that card and pretend to be you. So not all two combinations are equal. A better way of doing that design might be to have a hard token like a card, and then a second factor like a biometric. That's very difficult to spoof.
Right, because I can't give somebody my biometric.
Exactly. Well, not easily anyway.
Not easily, no. So, based on the information you provided, how would a hospital choose what authenticators they want to use in what combination in their healthcare facility?
Excellent question. That's a very difficult one to have a single solution that all hospitals in all situations can accommodate or would adopt. Some things that an organization needs to think about, not only is the cost of the hardware, the cost of the solution that they might want to deploy, do they choose to do this in a multi-factor design, meaning that they're going to accept two factors of two different types, but also the patient population. Are the patients going to be willing and able to participate in the multi-factor design? So cost, usefulness, utilization, these are all factors that one should consider. Very common authenticators used in healthcare tend to be things like fingerprint, a card token, palm vein scan. These are all tokens that we see commonly used in healthcare organizations today.
To learn more about what authenticators Amy offers to positively identify patients, visit lifemedid.com. Catherine, thank you so much for joining us today. And to all of our listeners, stay tuned, same time next week for our next IDChat podcast topic.